Can everybody hear me okay? Yes? Hello there everybody, I'm Julie and I am, as Dr. Bell very nicely said, thank you very much for asking me along, and I work in Belfast Trust in rheumatology, and I've been there for, well, quite some time, and I think I've recognised a few faces here today. So what I really wanted to speak to you about today was a kind of a bit of a combination. I know that physio is probably one of the multidisciplinary professions that you'll probably come across quite a lot, but there can be maybe more to it than necessarily people know about. And I know as well that we get a terrible, terrible reputation at times, but hopefully we can go through some stuff today and we can explain why, and maybe the motives behind the things that for you as patients with lupus we can at times make you do. But really the crux of it all is for us as physios is this is it really. It's looking at the rehabilitation. We can't cure the disease, and your medications are going to try to keep the disease under control, but what we can do is to really help to manage the consequences of what's going on with you. And I thought this was a lovely phrase, a lovely way to put it. So we're managing the consequences, the physical consequences us as physios are trying to deal with. Now, this is probably more what you would think about when you think about physiotherapy, but we really do try to move away from this particular reputation. I've been called many names in my years as a physio, but yeah, this would be probably the favourite one, and everybody thinks they're very funny. We've been smiling assassins, slave drivers, you name it, we're there. But really, I like to think that we are really there to motivate you. That's what we are. We're your conscience in a lot of the cases, and pointing you in the right direction. In particular, I think with lupus, as it's been mentioned by the previous speaker, it is such a complicated and varied condition, and the implications for all the different aspects and how they have an impact on your life, they're so varied that we couldn't possibly say, you know, we do this, this and this, we are going to make you all better. That would be lovely if it was a textbook. If everybody was a textbook case, wouldn't it be great? I would write the textbook and I would be away and wouldn't be working every day. But instead, what we've got to do is we've got to be looking at how it's impacting on you, not just what particular aspects affect you overall, but what is affecting you at that particular time. So the main aims of physio in rheumatology in general, we do try to help to reduce the pain, but we're also looking to mobilise the joints. As the previous speaker said, the musculoskeletal system is one of the areas where we would, and actually it was very interesting that the Northern European seems to be affected more musculoskeletally. So we're looking to mobilise joints, to strengthen your muscles. You probably know all these kinds of things, but the bottom three I think are the really important ones. We're helping to maximise your functional independence. Everybody's got to live their life. You know, you can have a diagnosis, but you've got to live your life. And if we can help you in very small ways to move on and to work independently, then that's what we're here for. And not just to educate the patient, but also families and carers. I also work in paediatric rheumatology, and I think this is a major thing in paediatrics, is you have to bring the parents and the family along with you. When you have a diagnosis of a condition like this, oftentimes when a diagnosis is made, this is very often the very first time people have heard of these things. So it's showing you that it's okay to move, that it's okay to do things again, and that's what we're hopefully going to point you in that direction. And finally, obviously, it is to motivate. Yes, I like this one. We're big Lego fans in our house, and at the minute we find, yes, Lego pieces are everywhere. But I thought this was good because I know everyone here knows, and the previous speaker has said, lupus doesn't just affect one system in the body, it affects lots and lots of systems. As physios, we focus mainly on the musculoskeletal system, the muscles and the joints. I often say to patients, I'm not very good with innards. I'm good with all the bits and pieces, the muscles and the joints, but when it comes to the things like, you know, into your digestive system and the kidneys and things like that, we kind of struggle to reach there as much. But I read an interesting thing that said from 53 to 95% of patients diagnosed with lupus have some musculoskeletal problems at some point during the course of their disease. So our main job is really looking at you physically. So we're working alongside the doctors. You know, the medications are there to kind of keep things under control, but we're working alongside that, and hopefully, and we can bring you through. For example, we know some of the medications take a little while to get started. They take a few months to work their way into the system, and in that window, if you're in a flare, we can help there too, to show you, to give you tools that you can use, as well as the medications, things that you can try to make you feel better. All right. Another Lego man. Okay, so what we're going to be trying to do today is we're going to talk about the ways that we can help you to decrease. And we talked about decreasing pain. We also talked about improving your strength and your movement. But this very much is a two-way process. We have to work with you, because what we will think as being the most important thing at that time, and we as physios sometimes can get quite focused on numbers. Oh, we need to get 90 degrees of movement at your knee. But that might not be at all what's important to you. So it's very much, we try and encourage a two-way process of you telling us what's important to you, because it can be very, very different. I have found with a lot of experience that what I think is important is very different. So we're going to work very much in partnership with you, because what we think is important, you know, we might be looking at this lovely lady and thinking, oh, bless her, she wants to be able to get up and walk to the toilet, when in fact she wants to get back to this. So I'm not going to make anybody do this. If you end up in Belfast Trust, don't worry, this isn't a treatment goal, okay? So again, we're on the Lego theme here. We do want to work and help with pain relief, but I think this, we have experienced this a lot in our house, walking on Lego pieces. We have lots of kind of more physical ways to help you with pain, but a lot of the things that we're going to show you here now today are things that you can actually, a lot of them you can do yourself, and if you could persuade anyone in your home to help with these, that's all the better. So we talked about, the last speaker spoke about, which I think is really pertinent in physio, how there's lots of new treatments that come out, and there's new fancy exercises will come through, and there's fancy ways to look at things, but I think the hands-on can never be ignored. We have to go back to these sorts of things. So for pain relief, we would work on the joints, so some mobilizations, massage for the skin conditions as well. We would be looking sometimes as well at working on not just the muscles, but even the layer. There's a layer just underneath your skin, just above your muscles, called fascia, for example. So I think a good example of that is if you peel an orange, the orange still stays together. And the same thing with people. If perish the thought, if the skin came away, everything would stay where it was. And we can work on the fascia as well, which can work quite well with a lot of patients to help in pain relief. Good old heat and good old ice. And I know for different people, different things work better. Nobody, as I said, is a textbook case. But these are things as well for you at home. If you're having a flare affecting your muscles and your muscles and your joints, these are things that can really help you. These are tools that we want to educate you to know. Try these things at home, and then it's allowing you to help to take back some of the control, so you can help to control your own symptoms instead of always feeling you have to rely on going to the doctor or going to the physio. But there are things we do which hopefully you won't try this at home. We have other things, lots of options available to us for the likes of acupuncture, and then also what we would describe as therapeutic exercise. So those are exercises very specific to you for your particular problem at that particular time. In Musgrave, we are completely blessed with our fantastic hydrotherapy pool. Again, we're not going to make you do this. This isn't a treatment down in Musgrave. But we are big fans, and I am a huge fan of aquatic therapy. And I have spotted a physio in the audience who is of a similar thinking. And the water, either going, and if you go for hydrotherapy, it's fantastic, but if you even go yourself to a pool. Our pools, hydrotherapy pools, are mainly different from your ordinary pools in the temperature. Apart from that, the physical properties of any pool you go to will be the same. And the biggest thing I feel is not so much the heat, it's the buoyancy. When you get into water, everybody knows. You know that feeling when you get into a warm bath and the noise that is heard is, we get that in the hydro pool in Musgrave every day, and we point out to patients we get paid for it. It's very good. But it is one of those things, if you go yourself to your local pool, if you are having problems with your joints, here's the boring science of it, if you are up to your hips in water, there is only half your body weight going through the joints and the rest of your body. If you're up to here, the bony bit just here at your collarbones, 10% of your body weight going down through your feet. So if you're sore and it's difficult to move and you're having a general flare, what's not to love? It's certainly worth a try, isn't it? And exercise, and here you go. Everybody's going, oh no, she's going to talk all about that. She's going to make me do stuff. But there is no doubt about it. Exercise, it has to be the cornerstone as well. It is trying to keep yourself moving and keep yourself active. I'm going to talk about that more in a wee minute. But what I wanted to talk about is the difference really between what we would call therapeutic exercise and what we would really describe general physical activity. So, The therapeutic exercise, as far as a physio is concerned, we're going to be, when you come to us and you're being assessed by a physio, they're going to be looking at your issues. So that can be things like, as we said before, with the way the medications are now, your disease can be quiet. And then what we're finding more and more with the new medications is that ordinary musculoskeletal problems that the rest of the population deal with, it can be seen. They're not necessarily to do with your lupus. So we will be looking and helping you, point you in the right direction to get over the effects, the biomechanical effects of what's going on with you. So we're going to be looking at trying to mobilise joints and to strengthen muscles which might have got tight. Examples being, for example, like sore neck. And if you're very, very stiff and sore in your neck, what do? We all kind of do this, and we'll kind of try to protect ourselves, and everything here will tighten. Everything at the front will tighten, everything at the back will loosen and get a bit weak. So we're trying to point you in the right direction, and these are things that you might not notice you're even doing because it happens quite gradually, doesn't it? If you have been sore for quite a while and you've had a flare, we're human beings, we will try to protect ourselves. So what we hope to do is to help you come through that phase, come through those particular problems, but without the sort of long-term implications that you can have. A bit like if you go over in your ankle, which I'm sure some people here know that I very stupidly did a few weeks ago. We limp for a while, but we know we've got to get back to walking, and what we hope to do is to guide you in that direction. All right. So, the exercises are tailored to your specific needs. So they're not in place of physical activity. So they may be for a particular joint, they may be for a particular muscle, or they could be postural, even as simple as posture. So what we're really looking to do, I love this Pilates with carpet. Pilates would be one of the things that we would do. It's a lovely form of exercise in that it's not a high impact one, and it's not an awful lot of skill involved once you're shown what to do. So it can be something that you can get started without worrying, because I know at the start with a lot of patients when they're first diagnosed, they're very, very worried about doing things that are going to potentially make their condition worse. So the aims of our exercise in general are, with therapeutic exercise, to reduce your pain and improve your muscle balance and strength through whatever means we have available to us, but we're going to tailor it to you. You know, we're not going to make you do something if you're not interested. I'm not going to get somebody into a pool who's petrified of water. I always find if you work with your patient, you're far more likely to gain the best outcome if you talk to them and move forward with them than if I try to impose what I think is the best thing on them. Another one, obviously, is maintaining joint stability, and the nature of inflammation being that sometimes the ligaments around your joints, the bits that hold bone to bone, and they can just get a little bit unstable. So we are trying to maintain those because we're trying to minimise the risk of long-term problems. And here we're coming to it, the improving exercise tolerance. If you speak to your physio, or if you're concerned at all about any exercise that you're doing, do speak to your physio, and they will tell you what are the best exercises for you, because we know that there's some exercises that aren't going to be suitable for everyone. We've talked already there now about unstable joints, but also decreased bone density and osteoporosis. There are some exercises that are going to really help to maintain your bone density. Most people here would know it's doing exercise that involves weight bearing, impact exercises, so the likes of walking, brisk walking, running if you feel up to it, things that are going to put a pressure through your joints. And then a lot of people don't realise, for example, that cycling is not great for this. It won't improve your bone density or improve your bone strength. And swimming, although very pleasant, and we would get a lot of people to do it, it's not, again, going to make a difference with osteoporosis. As well as that, with the likes of Pilates, there are certain exercises that you wouldn't do and we wouldn't want you to do if you are at risk of osteoporosis. So do speak to either if you're going to do some exercise, speak to whoever's running the class, or speak to your physio or your consultant beforehand about that. We spoke, the previous speaker as well was talking about inflammation of muscle, and it would be another thing that we would just err on the side of caution. So if those sorts of things are going on, if you're in any doubt at all, speak to your physio. And the stage of the disease. Early on in lupus, you probably all already noticed there's a lot of symptoms which will be completely different to later on when the disease is established. So the stage of your disease can influence what we're going to do with you. So if you're speaking to your physio, they will have looked into that and hopefully point you in the right direction depending on what's going on with you. Okay, so a quick question to think about. So I want you can keep it in your head or you can discuss it with your neighbour, but I want you to think about, in the past week, have you done any physical activity? or what level of physical activity. So what I'm talking about here is something that maybe you're just a little bit out of your comfort zone, you might have been a bit uncomfortable, you might be a bit short of breath, feeling a little bit sweaty for more than about 10 minutes. So we're not talking about, oh yes, I ran up the stairs once, we're talking about actual physical activity. You can discuss it or you can keep it quietly in your own head, but I want you to think about how much physical activity you've done. Not the exercises from the physio, but general activity. So what we're talking about here is, I wanted to ask as well, does anybody know or is anyone aware of the guidelines for the amount of physical activity adults should be doing? Even adults with rheumatological diseases, yes. I'm seeing a couple of nodding heads, and I'm seeing lots of not eye contact with me as well. All right, I think even that is very interesting. So, there's about anything in my little subliminal message for you. What we're, 150 hours of moderate intensity exercise per week. Does this match up with anybody's little previous sum in their head? So, 150 hours of, and this is including rheumatology patients. This isn't just the general population. And I think a really important thing to know is that we're not talking 150 hours all in one go. We're talking half an hour over the course, on most days during the week. For children, it's more. For children, it should be an hour a day, is what they're saying. So you're kind of measuring this up in your head. Minutes? Did I write hours? This is why I get a bad reputation. If I told you you do 150 hours a week, oh, folks, I'm so sorry. I have shown this to at least 4 other physios, and not one of them has noticed this. You see? 150 minutes. I'm so sorry. Oh, you see? Spell check wouldn't have picked that up, even sure wouldn't it? All right, 150 minutes, don't panic, but 150 minutes in the week, all right? So about 30 minutes, and you have to be doing a minimum of 10 minutes at a time. And as I say, you're talking about moderate intensity. So what do I mean by moderate intensity? This is what most people think physios are going to make them do. We're not talking about this. We're not talking about this level of intensity, because as I say, without it, we do get a bad reputation. But this isn't what we're talking about. I treat paediatrics as well in Musgrave, and we had a lovely wee fella a few weeks ago in clinic, a wee person, I think he was about 4 or 5, and he'd been diagnosed with juvenile arthritis, but he was feeling brilliant, and it started back, and he started playing football, and he said to me, do you know the most important thing about football? And I said, what is it? You must be able to kick the ball and not fall over. And I thought that was brilliant. But my point to you is you want to be able to exercise but not fall over at the end. So we're not talking about this horrible level of activity. We're talking about moderate intensity of activity. Can you see that? Because it's not very clear. This is what we would use this kind of scale of what we've got breathlessness. It's called the Board breathlessness scale. And it talks about, 1, as you can see here, I'm watching TV and eating bonbons, so you're not out of puff at all, right up to the very top, which isn't very pleasant. Okay? But where we're really looking for you to exercise will be round about in the middle there, the wee yellow man in the middle, and they see the top green man. You're sweating a bit, you're feeling good, but you should be able to talk comfortably. The thing I really like about this scale is it's different for everybody. It doesn't matter what level of activity you are at now in your head. If you are completely inactive, you can use this scale. You don't have to compare yourself against anyone else. You're only thinking about you. Apparently, by being even aware of these physical activity recommendations, obviously not the 150 hours, Julie Monaghan ones, the 150 minutes, apparently even by being aware of those today, a certain proportion of people who have never heard of these apparently are making you 4 times more likely to try and stick to them. So that's good, isn't it? Even just by thinking about it, we're pointing you in that direction, okay? And the other good thing to know is, there's a lot of research been done recently into this in rheumatology in levels of physical activity. Because when patients are diagnosed with a rheumatological condition, and lupus is included in this, one of the things they do, they think, oh, I can't do anything. I just have to stop doing things now. And one of the things the research has shown is if you even go today, if you're completely inactive, and you go today and start to be even a bit active, that can give you really big health benefits. Just going from completely inactive to a very, very low level of activity can improve things for you. So here's our scale sideways. So where we're looking for, so this is more related to functional, different things that you can maybe try doing. So we're looking to be round about in the middle here. So you're just a wee bit short of breath, as I said, a wee bit sweating a little bit, and you're starting it around about, if you can, about 10 minutes at a time. Another question for you. In the last few days, how much time have you spent sitting down, doing nothing? So you're thinking about in work or at home, how many hours in the last week have you spent inactive? So it's one of those ones that now and then, so you can share this again with your neighbour if you want to, or maybe you do want to keep that to yourself. I always remember when we were students, we used to be very, very embarrassed at times where, do you remember Neighbours used to be on at about 5:30 back in the day? And then next thing we would know the 10 o'clock news would be coming on, and we would still be parked in front of the TV. So it's one of those that you without realising we can get caught up in screens, 21st century, we can get caught up in screens, and next thing you know, hours have passed. We become our couch potatoes. But the World Health Organization, they have said that inactivity is now the 4th leading risk factor for mortality. So we really want to look about, in Musgrave, we just carried out a wee audit, and we audited outpatients and asked about how much physical activity that they are doing. And we found that 2/3 of the people we audited, which included lupus patients, were doing nowhere near the levels of physical activity they could. But what I want to think about and talk to you about today is, why not? What are the barriers to us being more active? What are our barriers? Now, I did put out on some of the chairs, and I don't know if all the chairs got them. There's a wee quiz. You can do it yourself now, or you can do it later. But we're really thinking about, what are your barriers? Why are we not as physically active as we could be? In various chronic conditions, there are very, very genuine concerns about why you don't want to be active. There's a lot of fear involved. I'll flare up my condition, I'll make things worse. And I know specifically to lupus, there's lots of issues that we can come across. Fatigue being a big one. I'm just too tired. I'm completely floored. I couldn't possibly go out and do any exercise. Some of the research recently that has looked into physical activity has shown that a small moderate amount of exercise can really, really decrease levels of fatigue. More so, they compared it with relaxation, and the exercise decreased the fatigue more than relaxation techniques. And again, they were talking about a brisk walk. They were talking about a 15-minute brisk walk. They compared people who didn't, or who went and had relaxation techniques, and people who did nothing compared to people who just did a very small amount of exercise. Joint pains. Pain would be another one. I always laugh when you read these scientific research papers, and they said they found a very strong link between pain and quality of life. And I thought, you don't say. So you really need to spend thousands of pounds on that research to tell you what most people know already. But what I'm talking about here, when you're trying to get active and get yourself moving, is finding something that works for you and modifying it according to, if you are in pain. We were on a course yesterday, and it was for patients with ankylosing spondylitis, another rheumatology condition, and we were all in the pool doing exercises. And at one stage, the physio who was teaching us the exercises in the pool had us all running around the pool and everything else. And then she said, "Is everybody out of breath? Is everybody out of breath?" And a couple of, I thought, particularly stupid physios said no. And so she made us all go down into the water and start even just punching out in the water. And next thing she said, "Are you out of breath now?" Yes. Using our upper body can get us and work as our cardiovascular system as well as if we were doing that. So it's a matter of modifying. If you're having problems with one part of your body, trying to modify it so that you can still keep yourself active. Other things you can try if you're having particular joint pains, you can try unloading the joint for a little while. We've talked about isolations of that. You can try taping as well. If you speak to your physio, they can show you ways that can unload the joint if you are having particular problems with joint pain and swelling. And in the same way, I know obviously a lot of people have circulatory issues as well. It's trying to find things that work for you. So if, for example, at the time of year, if you can't go outside because it's just too cold and it can really affect your Raynaud's and those things like that, it's a matter of maybe having a backup plan, having an indoor backup plan. And I know the other worries people have, or what about my other conditions? What about my other issues? I've got problems with my kidneys, or I'm having some problems with my skin at the minute. These are issues. Speak to, if you're in any doubt about trying something new, just don't hesitate. Speak to the professionals. That's what we're here for, to talk you through it and have suggestions for you. Okay, if anybody's done the quiz, has anybody seen what their barriers are? It's quite good. If the wee quiz on the back, it breaks it down as well. If you score higher than a 5 in particular areas, you know that what your barriers are. I did mine, and I'm embarrassed to say that it's lack of willpower. So it's a matter of, yes, of sticking to it. Does anybody recognise that, by the way? That's Game of Thrones, big Game of Thrones fan? No? Nobody else in the room? The walls, yes. Okay, so we want to really help you to break down your barriers. You really, really can do this. So, things like, I can't get out, I don't have the time, the kids are at home, everything else. Front of the TV, you can do your stretches and exercises. Some of the patients who've seen me in the past may have had me talk about their Coronation Street exercises, and the music from Coronation Street being the memory trigger to them, oh, this is when I'm meant to do those particular exercises. So it's a matter of adapting it and fitting it in with your day. If you make time for something, if you plan ahead, you are more likely to do it and more likely to stick to it. Or maybe a group things for you. Maybe you like the social thing and the water. There's lots of, most places now, most leisure centres or well-being centres will have some form of aquarobics or some form of class that you can choose something that you like. If you do prefer a group option, but maybe you don't. Maybe you could use this as you time. If you've got a busy, hectic house, maybe you want to escape. It's an excuse, oh, I need to do my physical activity, and take yourself away and use it for your relaxation. Or getting out and about. You don't need fancy pieces of equipment. Pick something that you're likely to stick to. Pick something that suits you, and that could be as simple as walking. Or something fancier, if you want a bit of fun. I loved this. Did everybody see this last week on Strictly? Fantastic, it was absolutely brilliant. So it's picking something that you are likely to stick. If you enjoy something, you're much, much, much more likely to stick to doing it. Or you can put it into your day, supermarket sweep style, walking around a little bit quicker. If you adapt in either the school run, walk a little bit further, get off a bus stop earlier if you're on your way to work, or just walking that wee bit farther. Or as well, the other thing a lot of people say, oh, I don't get support from my family, but it's trying to get out with your family, involve people. It also kind of makes you a wee bit more accountable, doesn't it? If you say to somebody, oh, I'm meeting you for a walk, then you're more likely to go and meet them for that walk. And the point, I think this is a really great slide. You don't have to be fit and healthy to start, but you do have to start to be fit and healthy. Although if you have had a diagnosis of a rheumatology condition, and lupus being one of them, it doesn't mean you should stop doing all the other things. We know that lupus, you're at high risk of cardiovascular disease, and the same as the rest of the population. If you don't exercise and look after yourself, you're still going to be putting yourself at that same risk of all the same things as the rest of the population who don't exercise. Alrighty, and a goal without a plan is just a wish. I like a plan. If you are more likely to do something if you do plan ahead and decide what it is you're going to do. So, the easy and a really simple way I would think of to say to you to do is to go and think of something that you would like to do, some form of physical activity. Get a timer, time yourself to see whenever you start to do this activity until you feel a change in your symptoms. So whether that is maybe your pain goes up a wee bit, maybe you get a wee bit short of breath, or maybe you're just getting a bit tired, stop then. Note that down, and that time is your baseline. That is your baseline. And as I say, that will be completely different from different people in the room. And then a really easy way to progress that on is you're going to start below that. You're going to start between 50 and 75% of that. So you're not even going to be feeling any symptoms the first time you set out on your strategy forward. Okay? The classic thing that people do is they go boom and bust. They're all feeling great and they go out and they try to conquer the nation. Instead, take it small increments at a time. Try to build yourself up gradually. We are far more likely to stick to it in the same way if you build up gradually. And the other thing is, if you do find yourself and you do have a flare in your symptoms, the temptation is to go, oh, that was dreadful. It's because that terrible physio, she told me to do that, and it was awful and I felt dreadful. And stop doing anything. No, just step back a wee bit. Turn down the volume on the activity that you're doing. Step back a wee bit, and then start to progress yourself forward. It is important to progress yourself, but to do it in a nice, slow, staged way. Another story I heard of was at a talk I was at. It was about something completely different. But the man told a story about his grandson. He was babysitting for his grandson, and he popped him into bed and went downstairs. 10 or 15 minutes later, heard an almighty thud and went up, and the grandson was on the floor. He said, what happened to you? and the grandson said, I stayed too close to where I went in. And I think that was really good. I stayed too close to where I went in. So that's what I'm saying. It's important to move yourself forward. You're more likely to stick with something if you keep going and going and going. And you keep it regular. If you don't do that, you'll fall out of bed. Okay, so we've talked about that. So this is another really simple wee one. Again, it's not very clear, but I thought this was lovely. Small, small increments. It's a wee bit blurry at the bottom, so it says, how to learn to jump rope. Watch mum jump rope. Try jumping in slow motion. Practice for 5 minutes. 2 in a row. Practice for 5 minutes. Small, small increments until you reach your goal. And it's your goal, remember, it's nobody else's. And remember as well that if you haven't been active for a while and with inflammation in your muscles and your joints, they are going to be weakened. So don't be surprised by this. Whenever you start to do something, you do have to build it up gradually, because your muscles at times, I would say to patients a lot, your muscles have forgotten that they have a job to do at times, and you have to remind them that they have that job to do. So we're back to our Nike thing again. In the words of Nike, just do it. But I'm not even saying just do it, I'm saying just try it. Try and see if you feel better. If you stick to it for a period of time, set a small goal in your head and to see how you feel. Go back to that. Any questions? I know! He was marvellous, first 10 last week apparently. Thank you.